My name's Maggie. I'm one of the educators in the operating room, and we set this class up for observers to gain information that they would need when they come and visit in one of the ORs as an observer. Before you come to the operating room, depending on who your sponsor is or what your clinical rotation is, you should have an idea of which operating room area you're in. There's a total of 4 different operating rooms. The majority of students and observers observe in Mather operating room. Mather operating room is located in this building, Mather Pavilion. But no matter which operating room, whether it's Mather operating room, Prentice, Humphrey, or Mather Outpatient Surgery Center, your entry point into the operating room area will be the control desk. Access to the operating rooms are restricted. So in the morning when you get here, outside of each different operating room, there's a swipe or an intercom. If there's nobody there that's walking in, you're going to press the intercom and say, "Hi, my name is Maggie. I'm a nursing student, PT student, pharmacy student, and I'm going to be observing today," and then they will unlock the doors. When you go to the control desk, the most important thing that you're going to do on the day that you come to the operating room is you're going to have your ID on. IDs are given by the Department of Volunteer Services if you're a student observer from a school that is not doing a clinical rotation here. These IDs are now going to be green, signifying that you have taken the observer class and passed the post test. If you are a student, nursing student, PT student, pharmacy student that is here for clinical rotation, you will receive a green sticker after you complete the class that you will put on your ID. That signifies to everyone that you had this mandatory observer training. On the days that you're coming to the OR for observation, we recommend that you come at 6:30 in the morning. If you come earlier than 6:30, the secretaries are busy at the control desk and you're sort of a distraction. So 6:30 is a good time for you to come, get what you need, get signed in, get dressed, and be ready. Our goal is always to have the patient in the room ready for surgery at 7:15 in the morning. That all changes if you're coming on a Wednesday. Wednesday, we have conference in the morning, anesthesia, surgery, nursing, so we start an hour later. So the time for Wednesdays is 7:30 in the morning. So when you come to the operating room, you're going to have your ID on, and then you're going to approach the control desk. The control desk area in all 4 operating rooms is behind glass, and there's always a person to greet you there, and it's usually the secretary. When you meet the secretary, you're going to say, "Hi, my name is Sam. I'm a biomedical engineer," and they're going to hand you the observer book. When you get the observer book, you're going to sign in by writing down your first and last name. If you know the surgeon that you're observing, you write down the surgeon's name, and then your affiliation, whether it's a college or pharmacy student, all that kind of thing. After you sign in, the secretary will give you a Post-it note with a locker number on it. Or if you're in Mosque or Humphrey or Prentice, they're going to give you a locker key that's kind of like a locker at Cedar Point, a little tiny locker. The locker rooms are either located right across from the control desk or in Mather operating room. If you look at the map, if you turn around from the control desk area, which is here, and you look immediately behind you, there's a stairway going up to the 3rd floor, and that's where the locker rooms are located. The other thing besides giving you the locker combination they're going to give you is something called a scrub-avail pass. A scrub-avail pass is on a long key ring, and it's a white, it looks a little bit like a credit card with this red sticker on it attached to a giant key ring because we don't want you to lose it. Every observer coming into the OR gets scrubs with that pass. So the secretary's handed out to you, and you're going to take that upstairs with you to the locker room to get dressed. A good place to put your locker combination is right on the back of your ID, because it's on a Post-it note, and then you'll have it for the day, okay? So after you've signed in, you've got a locker, you have the Scrub-A-Vail pass, you're going to go to the locker room. In some of the areas like Prentice and Moss, they will take you to the locker room, and they will take you to the Scrub-A-Vail machine. We get our scrubs from a machine called Scrub-A-Vail, and there's a lot of science and theory behind that. We know that from our policy, which is included in your packet, that we want everyone to start the day with a clean pair of scrubs on in the Department of Operative Services. So we also know that there's a particular way that you can wash scrubs that kills things like VRE, C. diff, methicillin-resistant staph. So we want everyone that's coming into the operating room and that's going to be in a patient care area to have a clean pair of scrubs on for the day. The scrub and dress code policy is in these packets, but what you need to know is that the dress code for entering the restricted area of the operating room, which we'll talk about in a little bit, is that it's this top and then a pair of pants, drawstring pants that the Scrub-A-Vail machine will give you. I always tell people you can wear whatever you want underneath your scrubs, but I shouldn't see anything. So I should not see a t-shirt or a tank top, and I should not see sleeves extending from the short sleeves on the arms. And the reason for that is we try to control the exposure of the patient to bringing outside bacteria, germs into the operating room. So when you go up to the locker room, in Mather, you're gonna head to the back of the locker room, which is where the observer lockers are. There's 300 lockers up there. So usually the observer lockers are 1 through 30, somewhere in there. You're going to open up your combination, throw everything in your locker, and then head to the back of the locker room where the Scrub-A-Vail machine is. You take the card that the secretary gave you, and the first thing you do is swipe it and select the option to change size. And then there's a menu on the front of the machine with about 30 different options you can select from of sizes. Not 30, probably 20. Anyway, you select what you think your size will be. Then you're going to swipe again, and you're going to select the option to collect. After the machine gets that, it'll say, open up door number 1 through 9, okay? And you pull the door open, and folded together will be the top and the pair of pants. You grab it out, and the door slams shut. Then you go to your locker, you get dressed. The locker rooms have masks and hats up there, but you do not need to grab those right away. There's areas closer to the restricted area where you can grab them. Do not bring 500 credit cards, $1,000 cash, anything like that on the day that you're coming to the OR. The observer lockers you might be sharing with someone, so only bring what you need for that day. That's a good advice for you for the rest of your career. Only bring what you need for the day, which is lunch money. Phones, our policy says no cell phones in the operating room. Our culture is that probably 90% of the staff has them. What I tell observers and students is, you can elect to have your cell phone with you, but no one should ever know it. The main breaches that we have with cell phones are photographs, and no one's allowed to take a picture in the operating room area of anything without the patient's consent. And we don't have consent for patients for that. So your phone, if it's with you, nobody should know that you have a phone. So that means all alerts are turned off. That means that you are not texting in the operating room area at all. Safe places to text are the locker rooms and when you go to lunch. Okay, not out here in the waiting room area, not over by the stairwells, no patient care areas or where their families are. After you're dressed, you're going to leave everything in your locker. You can bring paper into the operating room. You cannot bring a lab coat. You cannot bring a briefcase. You cannot bring a book bag. And again, all of that is to minimize what we're bringing into the operating room environment. So now you're going to come downstairs. In this diagram where the operating room desk is, most operating room areas are comprised of 3 areas. One is completely unrestricted, which means you can be dressed any way you want without subjecting patients to any kind of harm. And that's really this whole area at the top of the diagram, the control desk and the pre and post-op areas. Once you're getting closer to the operating rooms, you're moving into the restricted area. In Mather operating room, the control desk is here. If you turn around and look down this hallway, it's down the hallway. And anytime you're getting close to a restricted area anywhere in a hospital, you're going to see a cart with things like hats and masks and shoe covers on it. So right over here in Mather, by the locker room door that you just came down from, is a cart with hats and masks. I want you to grab a hat and put it on. For hats, the objective is to cover all of your hair before you cross into the restricted area. So there's several types of hats. This is the most common one, the bouffant hat, and the objective is to cover all your hair. Then you're going to select a mask. There's probably 3 or 4 masks at every desk. I like to recommend the white mask for observers because it's a little bit more easier to breathe through. And breathing through a mask for a lot of people is a challenge when you first come into an operating room, because up until this point you probably have not had a mask on for longer than an hour or 2. So the rule of thumbs with masks, no matter which you select, is blue on the outside. So there's blue over here on this, and then blue on this, and then metal on top, because the metal is going to cover your nose. The objective of the mask is to completely cover your nose and mouth. And what you'll see people do, even though you don't need to have this up in the non-restricted area, you'll see people grab their mask and put it on in the morning when they're putting their hat on, and then they will pull it down, okay, until they walk into the operating room. So once you cross the yellow line into the restricted area, you're dressed in surgical attire. You might have, if you're lucky enough, next to the scrub-a-bale machines up in the locker, there are scrub jackets. And grab a jacket. We like observers to wear them, not just because ORs tend to be a little bit cooler sometimes, but also to minimize, we call it scruff, it's skin cells. So if you can grab a jacket. Then you're going to come over to the area where you're walking into the operating room, and the restricted area is defined by yellow tape on the floor. Okay? Once you take one step over that yellow tape, you're entering the restricted area of the operating room. That means your hair is covered, you have a mask with you, and you're dressed in surgical attire. Okay? In Mather operating rooms, there are 24 rooms, but really only 23 because we don't have a room 13. Before you walk into any of the outer doors into the inside rooms, your mask goes up. You're going to assume that the room is open, which means sterile supplies are open, okay? Anytime a room is open and sterile supplies are being readied for the patient, then your mask is up in the room. And as a student and observer, you're never the first person to take your mask down. You're going to wait and follow the cue of the people in the room. In the morning, before you get to the restricted area, you're going to have to figure out which operating room you're going into. So I got a little bit ahead, but we'll go back. Over on these walls that are on the opposite wall are 3 large TVs, plasma screen TVs that are the OR schedule. When you come into the operating room, this is why we like you to get here at 6:30 and get dressed and get back down from being dressed and turn the scrub-a-veil pass back into the secretary, okay? Because the next observer needs it. Then you're going to come over and look at the screens. If you know the surgeon that you're going to be with that day, you're going to look for that surgeon's names on the screen. If you don't and you're selecting the room that you're going to observe in, you are going to look at the screens and it has the procedures listed. So you're going to pick out of all the rooms, you're going to pick your top 2 cases that you would like to see. And the reason you pick 2 is that you might not get your first choice. We limit observers, total observers in operating rooms to 2. When you select the top 2 rooms that you want to go into, or when you find the room of the surgeon that you're going to observe, like Dr. Majarian is operating in room 3 today, and I know I'm with him, you're going to turn around exactly opposite from the surgery boards and walk into the lounge. That's where we do our assignments in the morning, and your contact person is going to be the charge nurse. You're going to look for the charge nurse, and you can just say, can somebody show me who the charge nurse is? And you approach the charge nurse and say, hi, my name is Sam. I'm observing in Dr. Majarian's room today, and that's room 3. Is that okay? And she will say yes or no, because it's based on a lot of other things, but she will help guide you with that. She will also try to introduce you to the nursing team for that room that day. So even if you're following a surgeon, you want to meet that nursing team because they're going to be the people that guide you throughout your day. The nursing team is a RN that is a circulator, and then a scrub person that can be an RN or a surge tech. And we try and introduce you to them in the lounge. If not, if it's busy and there's a lot of things going on, they can introduce you to a staff member that will take you across the yellow line into the restricted area and drop you off at the room you're going to, okay? Besides, one of the most important things is to have your ID, because you'll have trouble getting, we don't let unidentified people into the operating room areas. The second most important thing that you need to do is you need to eat breakfast on the morning that you're coming to observe in the operating room. We have people that faint probably once a week in the operating rooms, and the main causes are not eating breakfast and then the mask, okay? So you need to eat breakfast. When you have to eat breakfast, and then you have to eat lunch too, okay? And you'll hear OR people start talking about lunch at 11 o'clock because you ate breakfast at 5 o'clock. If you don't eat breakfast, your chances of fainting probably go up by 50%, okay? So make sure, and people will ask you right away, did you eat breakfast? If you didn't, in the lounge when you're talking to the charge nurse, there's vending machines, so get something to eat right then. After you go, now you're ready to go into the restricted area. You have your hat on, you have your mask on, and you're going to walk into this area and meet the team. Your goal when you walk into an operating room is to stay 2 feet away from anything open. Open means sterile supplies are open on the table, and usually they're draped with a blue drape, a green drape, and you know if you see anything metal like instruments or tools, as people like to say, stay away from that. Also stay away from if you happen to walk into a room and a patient is already prepped and draped. Your goal is to be 2 feet away from all that. When you walk into an operating room, your mask is up, your hat's on. You're going to kind of go straight to the back left-hand corner of the room. That's where you'll see a computer, and that's where the circulating nurse does all perioperative documentation in that computer. Right next to that computer is a grease board. And I want you to write your first and last name and what kind of student you are on that grease board. From the moment that you're entering that operating room area, you're part of that OR team for the day. And we write your name down in the intraoperative documentation as an observer. If you write your first and last name and what kind of student you are, anyone walking in that room can see who you are, and they don't have to ask you 1,000 times how to spell your name. From that point on, in that case, you're going to feel like you're pushed back in the corner a little bit, but that's a good thing. There's a lot of activity going on in the room. You will see the surgical team getting ready to accept the patient, which means the scrub person is setting up instruments. They're validating and dispensing medications onto the sterile field, and then the patient will enter the room. In Mather operating room, which is acute inpatient adult surgery, patients in the pre-op area, probably around 85% of them get a pre-op medication called Versed. Versed is an amnesic and an anti-anxiety drug, and so patients get that through an IV in the pre-op area before they ever cross the yellow line coming into the ORs. I always remind observers that no matter what your objective is, and you should know what your objective is for the day, why you're here, that the surgery and the room belongs to the patient on the day they're having a procedure. So patients are scared, they're nervous. When somebody comes to surgery, we take away their support systems because we take them away from their families. Then we put an IV in and we give them medications. So in many ways, we take away their voice then. They don't know, because it's an amnesic and an anti-anxiety drug, very few of them remember anything after they're giving that drug. But when you see them come into the operating room where you're at, they're awake, they're talking. So if they make eye contact with you, say good morning, and you'll see the surgical team trying to make them comfortable. You'll hear them saying, anesthesia will be asking them about their grandchildren, about what's your favorite vacation, pick out a good dream. It's always about the patient. The patient comes in the room, they seem like they haven't been sedated, but they have been. That's the beginning of anesthesia. The patient will move themselves over from the cart they came in onto the OR bed, and then you will see anesthesia take over the patient for a while. They will be making sure that they have good IV access because we put patients to sleep on the adult side first through sedation through their IV. Then we give them a paralytic agent, and if they're getting a general anesthetic along with sedation, and they're put to sleep with their IV before the breathing tube is put in. After they've been induced, the anesthesiologist will place an endotracheal tube in, and then sedation and anesthesia is maintained through the IV and through with gases throughout the case. Okay, pediatrics is different. We try not to do anything invasive to children before they come into the operating room. So we try, until they're around teenagers, we don't put IVs in children. So you will see children enter the operating room with maybe a parent. A parent can be dressed in a jumpsuit to come into the operating room area. It's a white paper suit, and these are only good for 15 minutes. So sometimes you'll see people or physicians put these on over their outer clothes and come into the operating room, but these are only good for 15 minutes in the operating room area. With children, children are brought into the room. They are sedated through gas over their face, usually nitrous oxide. They fall asleep, then anesthesia puts the IV in, then they intubate and induce the child. In Mather operating room, the only room that you cannot select to go into as a student or observer is room 23, which is the integrated MRI suite, and that's because you need safety training to go in there. If you're selecting cases from the board, the only case that I completely recommend not to observe in is a laminectomy or a spine case unless you have a burning desire, because your view looking over a surgeon's shoulder deep into a back is very minimal. But any procedure with things like words like microscope, laparoscopy, robot, anything with a title like that in it is a good case to observe on, because you will also be watching it on TV screens in the room. After the patient is taken care of by anesthesia and asleep, and you know, not all patients are asleep. I would say probably almost every orthopedic procedure now that's done over in Mather is done with sedation and a block. We don't do general anesthetics with them because we like patients that we found that they recover quickly if they are not completely put to sleep with all those chemicals maintaining sedation. So they will do blocks and then sedate the patient into a deep sleep so that they are really not aware of what's going on in a room, but they even do that for total joints now, total hip replacements, total knees. So be aware of the state of consciousness of the patient. I always tell people, assume that your patient is awake and that they can hear everything you say and you will never go wrong with your interaction with the team. After the patient, anesthesia sort of hands them over to the team, you will see a couple things happen. The surgeon, you might not have seen the surgeon in the room until this point, but the surgeon that is doing the case comes in the room and does a final timeout before we prep and drape the patient. The timeout is one of the key things we do for patient safety. And it's the surgeon that's operating that says, this is Mr. So-and-so. Today we're doing a right hip replacement on him. These are his films. He's allergic to penicillin. And at that point, it's up to any team member in the room to speak up regarding patient safety issues, anything like that. If you see something, even as an observer, if you see something like a seatbelt on the floor or the patient's arm fell off the arm board, it's up to you to speak up because sometimes you're the only person that sees that, and it's always a team effort, and it's always about the patient. After the surgeon does the timeout, he or she will go out into the hallway, and they will scrub in, okay? Observers do not scrub in, okay? Usually, it's a process when that happens, and usually over at Case, we let medical students scrub in their junior year, okay? So you don't scrub in, you don't intubate, you don't put the Foley in, you don't put an IV in, you don't really do anything. When you're dressed like OR people in this green and you have an ID badge on, the team will try to put you to work sometimes, and you have to know your own objectives, and you have to be able to say, no, I'm only here to observe today. That includes even grabbing the cart out from the hallway, because in order to get that cart for the patient, you need to know their name. And we don't even have you know their name most of the time, because in healthcare, we've gone to protecting patient rights so that people only need to know what they need to know to take care of that patient or to meet their objective for the day. So if you're a student and you want to know the patient's history, you can ask the surgeon that, or what led up to this case. The other thing is, if you know ahead of time what case you're going to observe, look it up on the internet, look it up wherever. There's so many tools out there, and there's virtual surgeries that you can watch. There's a site called edheads.com that you can, it's through Ohio State, and you can go on there and watch the sequence of a total joint replacement, a deep brain stimulator. Utilize those resources, because the more prepared you come for your experience, the better experience you're going to have. And that's another reason why I wanted you to meet the team in the lounges. If you connect and make a relationship with the scrub nurse and the circulating nurse, you'll be more comfortable asking them to help you and find out the good time to ask questions when you're at the field. When the team's out there scrubbing in, you're going to see a lot of things going on. That's when they will prep and drape the patient. The patient is prepped and draped, and that means they usually have blue drapes over them. Anesthesia's at the head of the bed. Usually there's a drape that totally cuts off anesthesia from the patient. If you're watching an open heart surgery, you'll be standing next to the anesthesiologist looking over the drape into the patient's chest. If you're watching a total joint, you'll be down by whatever extremity they're operating on. You will see many more tables than this, and much more larger tables than this with instruments and stuff on. When you're brought in to observe, you're going to be within 2 feet of the incision of the patient, but this circulating nurse is too close. Okay, because she is not a sterile member of the surgical team, but she is closer to that bed than 2 feet. It's always 2 feet away, okay? We talked about eating breakfast. So I always like to review what to do if you're not feeling normal in the operating room. Sometimes in the operating room, the biggest challenge for people coming into it is usually the environment. It's a strange environment. You probably have not been anywhere like it before. So I think that's why some people faint. First of all, if you're sick, do not come. Okay, if you're sick on the day you're supposed to observe, don't come, because you will not last with a mask over your face for the day. Plus, you don't want to expose the patient and the surgical team to whatever germs you have. We can always reschedule. Second, if you're feeling funny in the room, your first objective, usually it's because the mask is up and your mouth is covered and people tend to hyperventilate. If you can get out of the room, if you exit the outer doors to the room into the hallway, you can pull your mask down and breathe in the hallway. The hallway is semi-restricted in that the mask doesn't need to be up. People usually feel better as soon as they do that. Every single operating room has windows, so you can stand outside and watch for a while if you're not certain about the way you feel. In surgery, we control bleeding with cautery, and it's a very strong smell, and it gets to people. It's the most pervasive at the beginning of the case. So you might just want to go outside and watch from the windows if that smell is getting to you, because you're not missing anything. It takes a surgeon, it can be anywhere from 5 minutes to an hour to get to whatever bone, vessel, organ they're operating on. So you're not missing anything if you're watching from the windows, because the smell of the cautery gets to a lot of people. If you're in the room and you don't think you can get out to the hallway, then I want you to go over and lean on a wall if you feel funny. People say they get really hot or really cold, they taste metal, they get tingling in their fingertips. You go and lean on a wall, and then if you really think you're going to faint or feel lightheaded, I want you to sit on the floor, okay? Never a chair or a stool. If you faint and you're sitting on a chair or a stool and the surgical team, their focus is on the patient, not you, and they know the student didn't feel good, so they put him in a chair. They forget about you, and they go back to taking care of that patient. If you faint and you're sitting in a chair, you can face plant onto the floor, okay? If you sit on the floor and you faint, people don't even tip all the way over. They kind of just slump. It can happen to anyone, and it does happen. So be aware of the way you're feeling. A lot of times, people will spot you in the hallway, random people, and they will see that you are pale or diaphoretic or shaky, and they will just take you to the lounge and give you cookies and a soda, and then you can go back in. Some people in the operating room, it's not the environment for them, and they know it immediately, okay? The main offenders are the bovie, the smell of the cautery, not eating, and sometimes it can just be the sound of a saw. It can be seeing a patient. They say, a lot of younger students will say, I never saw a person floppy, okay, like that. So just be aware of the way you're feeling. Okay. When you're observing the case, pick and choose your time. I would use a circulating nurse to guide you on when to ask questions. Once you're in an OR room, we want you there for your entire observation. We don't want you to go from room 1 to 2 to 3 to 4, because every time we minimize traffic in operating rooms, and we really minimize it in when cases are going, because it is good practice. It reduces the air coming in and out and the chances for contaminating, okay? When it's time for you to go to lunch, I want you to tell the team in the room, I'm going to go to lunch. Lunch is usually 45 minutes, and just so they know where you're going. When you come out to go to lunch, you're going to come back over the yellow line in the hallway. If you get lost, keep walking and you'll end up back where you started. You take your hat off and your mask off and you throw them away when you go to lunch, but you can wear your scrubs anywhere in the hospital. We used to make everyone wear lab coats, and we don't do that anymore because we found out the lab coats are dirtier than anything we could do. So you can go to the cafeteria, you can go to Java Jive, you can go to Einstein in scrubs. If you choose to go out to Starbucks or outside, we say you change your clothes and get new clothes when you come back in. Wearing these scrubs outside, you will see people do it all the time, and it's not good practice because it's bringing things like Aspergillus, Pseudomonas, things like that back into the OR, and we don't want you to do it. Then you're going to come back in, get a hat and mask, and go back into the operating room area. At the end of the day, when you're done, the first thing you do is you tell the team in the room that you're leaving. We don't like observers to be here after 3 o'clock because we go into kind of like weekend or add-on mode after then, and we don't expect learners to be here then. Our OR schedule is based really, in theory, from 7 to 3. So we don't think students are here after 3 o'clock. When you leave the room, you're going to go back to the control desk, get the Scrub Avail pass, go back up to your locker, flip your ID over. It should still be there, the observer locker. Get changed, and you're going to go back to the Scrub Avail machine, swipe the card, and select deposit. You're going to throw your dirty scrubs into the dirty side. Then you're going to come back and give the Scrub Avail pass to the secretary. In the back of your packets is an evaluation, and we like to hear about what your experience was and what you think other learners would benefit from. So if you have a chance, you could actually leave these at any control desk and they'll get back to us. You should call your clinical faculty if you're here for clinical and let them know you're going to be late, but no. But we really would like you to be here at 6:30 because it minimizes the interruptions. And once a team is in the room with the patient, it becomes disruptive as people are entering and leaving the room.
Thank you.
Oh, I always tell people you can wear whatever shoes you would wear into the clinical area, wear comfortable shoes. We have rules for people that work in the OR, no mesh tennis shoes, no Crocs. So clinical shoes. We have shoe covers. I don't like them because they're slippery by the scrub sinks. So as long as your shoes are clean, you should be fine with that. But if somebody tells you to put the shoe covers on, then you do that. And but be careful by the scrub sinks, they're slippery. If you remember, I told you, you can't intubate, you can't get the cart, you can't scrub in. If someone tells you to get a fire extinguisher, you can do that. And when we go over there and look at the outer area of the ORs, there's fire extinguishers and fire doors about every other room there. And that's because we would want to isolate and take care of a fire very quickly in these areas. Operating rooms are high potential risk for fire because it's an oxygen-rich environment. We use cautery, and we have gases that flow, so be aware of that. There's bathrooms in the front hallway and down. If you think of it as a vertical box, a square, the ORs, and down the vertical hallways in Mathers. You can go to the bathroom whenever you need to. This concludes observer class. Be sure to complete the post-test and submit that to the volunteers department to validate that you watched the video and that you're ready to come into our area. We hope that your experience meets all your learning objectives, and we welcome you.